Hospitals across Ontario say they're nearing the breaking point. A major pediatric hospital in Ottawa has called in the Red Cross to help them deal with a surge in respiratory illnesses, and experts say that could happen at more and more hospitals.
What I'm hearing from many of my colleagues who do work in the pediatric healthcare system is that this feels like March 2020 for them. This is absolutely unprecedented, and it should not be happening. We deserve to have a healthcare system that is not reliant on the Red Cross.
In a statement, the Children's Hospital of Eastern Ontario says in part, "We are partnering with the Red Cross, who will have a small team of staff starting next week to support our clinical teams. This will allow some of our redeployed staff to go back to their regular roles and ensure our team can provide the safe, world-class care that our patients deserve." Some doctors say the strain on the system could have been avoided.
As a family doctor, it's really not surprising. We knew that this was going to happen. We've been saying for weeks, if not for months, that this would happen.
Many hospitals have had to make drastic changes to keep up with patients. The Children's Hospital of Eastern Ontario opened up a second intensive care unit last month. Sick Kids was forced to temporarily reduce surgeries to preserve its critical care capacity. And the head of Ontario's Critical Care COVID-19 Command Centre asked adult hospitals to begin accepting children 14 and older.
We're seeing this across Canada. So really, it's incumbent upon all leaders at all levels of government to do what they can to help children.
Healthcare experts say the Ford government needs to do more to address underfunding and understaffing.
It's shocking to learn about how our government, the Ontario government, is underspending with respect to healthcare. Just last week, the Financial Accountability Office released a report with respect to this, which shows that we are underspending by $900 million in the first half of this fiscal year. So, of course, this money is desperately needed on the front lines, and I think we could do a lot more to support our health workers who are working very, very hard through this crisis.
It is also really important that politicians look at, like, why did they let the crisis in the pediatric world get to this point? That's a systemic issue, and it has to do with not valuing children's lives.
Health experts are urging parents and caregivers to vaccinate all their children against COVID-19 as well as the flu, wear masks when inside indoor spaces, and of course, stay home if you are sick. For City News, I'm Leah Johansen.